The Eastern Mediterranean region embraces 22 countries that can be generally characterized by demographic transition, epidemiological transition, socioeconomic change, political turmoil, and migration. Recently, many of these countries witnessed severe disturbances and political unrest or war that affected the health status and population demographics of the region. Unfortunately, the Eastern Mediterranean region became home to the Syrian crisis and struggles in Yemen, Iraq, and Afghanistan. Such situations impede development and affect the health, well-being, and the demographic distribution of the countries. As a regional public health network, EMPHNET aspires to assist countries in strengthening their public health systems by providing opportunities to advance applied epidemiology and public health. In the year 2008, a meeting was held during a global conference for the Training Programs in Epidemiology and Public Health Interventions Network, TEPHNET. The meeting brought together directors of field epidemiology training programs in Saudi Arabia, Egypt, and Jordan. They met with representatives from the Centers for Disease Control and Prevention. During this meeting, they discussed the need to establish a network that would facilitate and coordinate field epidemiology training program activities in the region. During a follow-up meeting held later that year, they agreed to establish a regional network with a consensus of having its headquarters in Amman. This is how EMPHNET was created. EMPHNET focuses on 4 key areas of public health. These areas are namely applied epidemiology and research, non-communicable diseases, communicable diseases, and health security. Within these areas, EMPHNET aspires to achieve better public health for people in the Eastern Mediterranean region. EMPHNET regularly works with 8 countries in the region: Saudi Arabia, Egypt, Iraq, Morocco, Jordan, Yemen, Pakistan, and Afghanistan. Recently, EMPHNET expands its umbrella to work with other countries from the region. Some of its key projects include the Mass Gathering Project in Iraq, which is a project that aims to reduce morbidity and mortality in Iraq mass gathering events. EMPHNET has also established itself as a training body in the Zaatari camp in Jordan, working in partnership with other health organizations to build capacities of public health officers working with the population of Syrian refugees residing there. In addition, EMPHNET has also made strides in raising the awareness of people in Ajloun in Jordan through its NCD project, which is designed to reduce the prevalence of non-communicable disease in that community. To improve surveillance, investigation, and response during outbreaks and disasters, EMPHNET launched a Rapid Response Team initiative, working to respond to the region's demand for rapid disease detection, investigation, and response. Recently, EMPHNET developed a roster of polio experts from the pool of human resources available at the regional level. Experts listed on the roster are to investigate and respond to polio outbreaks. To achieve its goals, EMPHNET regards capacity building as a key component to achieving better public health. It supports field epidemiology training programs and other public health officers and conducts training in topics ranging from scientific writing to Ebola rapid response teams training. It also attends and hosts conferences in an effort to provide opportunities for knowledge exchange and lessons learned from public health practitioners in the region. For the future, EMPHNET sees itself utilizing the latest channels of information and communication technology to bring about higher levels of awareness amongst populations in the quest for community change. EMPHNET also sees itself as a linking hub contributing in responding to the needs of healthcare specialists as their countries require an organization diverse in its outlook and ready to respond to a full range of needs. EMPHNET values the partnerships it holds with ministries of health in many countries in the region. It acknowledges the support and collaboration with international organizations, the U.S. Centers for Disease Control and Prevention, the Biosecurity Engagement Program implemented by the U.S. Department of State Bureau of International Security and Non-Proliferation Office of Cooperative Threat Reduction, World Health Organization, the training programs in epidemiology and public health interventions network, and all other entities it works with. Without such collaborations, EMPHNET would not be where it is today. It is also proud of the monumental work and engagement of the public health programs, as it is through this collaborative effort that the region will see higher public health standards for its communities.